Thank you everybody for joining. I hope everybody's been happy and healthy in the last couple of weeks since we have wrapped up our work in the BA program. I'm looking forward to seeing everybody's presentations. I'll jump right into mine, Policy, Advocacy, and Health Promotion for a Cancer-Free World. So my practicum experience at the Canadian Cancer Society. I'd like to first start by acknowledging the traditional territory on which I was a visitor throughout my placement. I worked in the Canadian Cancer Society office in Victoria, BC, which is the traditional land of the Songhees, Esquimalt, and Wasinic peoples. The Canadian Cancer Society is Canada's largest charitable funder of research into all types of cancer. They use private donations to provide support services to people living with cancer. The mission at the Canadian Cancer Society is the eradication of cancer and the enhancement of the quality of life of people living with cancer, and their vision is to create a world where no Canadian fears cancer. The Canadian Cancer Society operates regionally. During my placement, I worked from the Vancouver Island office in Victoria, which serves BC and Yukon. As the Policy and Advocacy Assistant, I worked under the Policy and Advocacy Lead, Jenny Byford, and she was an awesome supervisor and provided so much support and helped my learning a lot as I progressed in my placement. The Policy and Advocacy Department protects the health of Canadians by using a collective voice backed up by research to raise awareness and to create change. We raise awareness for everybody, but we focus on influencing governments to pass public policies and change them when appropriate. We can use public policy to help people from getting cancer and to help people living with cancer live longer and improve their quality of life. So some of the campaigns that CCS has been a part of include the ban on indoor tanning for youth under 18, which was a big one a number of years ago. And they advocate for financial supports and employment supports for people with cancer and their caregivers. So they also do a lot of work on youth vaping policies, which is what I focused on during my placement. One of the important pieces in policy and advocacy is stakeholder engagement. So in this little yellow circle here, we see a stat that grabs people's attention, and it's surprising to a lot of people, but it's also really scary. 1 in 2 Canadians will be diagnosed with cancer. Like many of us, I wondered if stakeholders often feel that there's little that we or they can do to actually prevent cancer. Because with a stat like 1 in 2, it almost feels like maybe you're flipping a coin with those odds. But many types of cancer are preventable. And I decided during my placement I wanted to help communicate the importance of reducing the prevalence of risk factors and communicate the message that sometimes there can be prevented. Stakeholder engagement is super important in any nonprofit, but especially in policy when we rely on stakeholders to carry our message forward. To guide my plan, I started by referring back to Brian's list of questions to identify stakeholders. So these questions are: who has the power, who benefits from changes in policy, and what's the nature of that change process? So throughout the process of improving stakeholder engagement and my placement in general, I was guided by 3 PHSP values: creating partnerships to influence change, political and awareness for social change, and community-based approaches to reduce preventable disease. I decided to work on a few projects rather than one big project. First, I assisted my supervisor in the development of youth vaping policy recommendations, and then I did a little bit of social media and stakeholder outreach. And then I worked with my supervisor to help deliver an MLA reception meeting, which has unfortunately been postponed indefinitely, but it was a really great learning experience. Since I don't have time to explain the processes involved in all 3 of these projects, I'll stick with youth vaping because it's such an interesting and emerging field of research right now. In December 2019, the government of British Columbia released the Vapor Products Intentions Paper, which outlined their proposed policy changes to be implemented in April. They called on outside organizations for input, including CCS, so this was a great opportunity to voice concerns about gateway nicotine use in youth vaping. Developing a briefing note was something that I was introduced through the BA program, but CCS has their own process for this, and Jenny was really great in explaining this process and helping me learn exactly how that goes. So first I started by reading the Vapor Products Intentions paper front to back, so I had a good idea of what the topics were. And then I dove into the most recent research that was most directly related to the Intentions paper and kind of worked my way out to less related but still important articles and research. Then, I conducted a more thorough analysis and began to categorize and document some of the articles and policies I found. So I was specifically targeting flavored nicotine products. Then I condensed the literature review, and then after all that prelim work was done, I pulled out the most important bits and created key messages to be used internally by CCS staff. So these are often like 1 or 2 sentence of information backed up by evidence with a reference to describe a finding. Finally, we used these key messages, and Jenny created a briefing note in response to the government's call for input. This project used PHSP skills of knowledge translation, communication strategies, integration of evidence-based literature. So throughout my placement, I did my best to operationalize call to action number 18. When working in policy development, it's super important to incorporate the critique of historical policies into research and recommendations. This helps to prevent repeating policies or pushing policies that are very similar to ones that have created harm in the past, so that's important. And final thoughts, the BA in Health and Community Services has offered me so many opportunities to apply what I learned in the virtual classroom to actual scenarios, which is fantastic. I really enjoyed the opportunity to be part of so many projects during my time at CCS, and I think this really helped me to understand what policy and advocacy is all about. So I'd like to say a big thank you to Jenny. She really helped me learn a lot throughout my placement and really inspired me to continue with policy and advocacy in the future. And also thank you to Natalie for your support throughout the last couple years, and especially during this placement, and Betty for helping me find and secure the placement at CCS. Thank you.